And the number I want to share with you guys today is 67%. That is the percentage of employees we've scanned who showed cardiometabolic risk. And what's more concerning is that they had no idea about their risk, typically what we see. So that gap you're seeing is exactly the issue. Industry completion rates for biometric screening are about 15 to 20%, which means 80% or more of your covered lives are never screened at all. From an employer's perspective, that means the majority of your population is effectively invisible from a risk standpoint to check your core health signals. In 30 seconds from wherever your employees are and whenever they want, no needles, no appointments, no disruption to the workday. That's what Hibiscus does. And as far as the results, across our existing deployment sites, in just the first email to employees, we see 40% of the company completing the scan. And with each additional email, we see about 10% more. So in total, we get about 60 to 70% of the company completing the screen and becoming aware of their well-being and health risks. From there, we see another 70% of those that do the scan opt in to schedule an appointment with one of our dietitians, effectively having an impact on almost half of your employees to avoid escalated risk. And before I show you how it works, I want to bring in Al. Al Lewis has spent his career holding the wellness industry accountable to real outcomes. Al, I'll hand it to you.
So I go over there, I look at this screen, they tell me I can get my blood values in 30 seconds. I'm like, yeah, right. And I looked at the screen and they got my blood values. I mean, they got my HbA1c within 1/10. They got my blood pressure within about 5 to 10 on each, 5 on the diastolic, 10 on the systolic. And we're got the good ranges on the cholesterol and whatnot. So I not only invested, I actually doubled my investment from what I had to do because I was so impressed with these people. They have done for screening what Cologuard has done for colon screening and colonoscopies.
Some of the things that we do look for that we are able to detect with the face scan is your overall cardiovascular disease risk. That is based on a score of your other vitals. But using your face data and the data that we collect from your face, we can get your blood pressure, your hemoglobin A1C risk, as Al mentioned, as well as your cholesterol risk, your triglyceride risk, and also your heart rate. So really, we're doing a really quick and important workup on your cardiometabolic health to get you to understand where you are and then take you to the next step. I really want to quickly show you what your employees will experience. This is a quick, non-invasive face scan that takes about 30 seconds. It works on a phone, it works on a computer, and we even have a kiosk that can be planted in the break room or somewhere in the office. So while your employees are microwaving their lunch or getting coffee, they can check their blood pressure or their vitals discreetly. So there's no prep, there's no fasting, there's no scheduling. For most employees, it feels more like taking a selfie than anything in healthcare. We know privacy is always appropriately top of mind. We are HIPAA compliant in all that we do. More importantly, no facial images are actually stored. So we do not collect nor do we store any facial images. What we do is we only look at the pixelation of waveforms in the cheek. And that is the data that we use to analyze an employee's risk. So the goal is simple. What we want employees to know is really, where do they stand? What should they do next? And that is really critical. And the face scan is designed to be highly sensitive. It will either say you're likely fine or more importantly, you're not fine and you should go get this lab test. From an employer's perspective, that's the right trade-off. You're not replacing labs at all, and you're not replacing care. So just so we can level set there, this is where we're dramatically expanding who actually gets to the point of needing one. So what I like to say is that we really are able to get de novo populations who are not currently part of the healthcare ecosystem into the funnel and allow them to screen with just a selfie and then know what their risks are and get them the next step or the next step in care so they know what they can get the care and know exactly what to do next. It is so important to understand that we are focused on getting them into the care system. And so with that, we'll have you try this directly.
Now, in
Yep.
my case, the crosshatch shows it at slightly into the orange, which would be slightly into pre-diabetic. If you look at my list of my overtimes there, I am slightly below slightly. I always refer to myself as borderline, borderline. So I'm getting about a 5.6 on the blood test. I was getting about a 5.8 here. However, in the last 2 months, my wife broke her ankle, and we have not been eating at home remotely as much as usual. Been doing a lot of takeout, a lot more junk. And I don't know how many of you live in the Northeast, but the weather's been really cold. So a lot of ultimate frisbee games have been canceled, and that's how I work off my sugar. So I would totally expect that if I went in for a lab test tomorrow, which I'm not going to do because I'm a new insurance and they're charging me for it now,
Yep.
I would show up at essentially exactly the same 5.8 that I'm showing up here.
Yep. And Al, I think this is a great representation. And what we see is that our algorithm is about 85 to 90% accurate on the cholesterol, triglycerides, and hemoglobin A1C. It's 98% accurate on the blood pressure and the heart rate. So and I just did the scan and I had blood work this morning, so we can share mine. So in my case here, blood pressure is a little high because I just did this in front of almost 100 people. So we have a high blood pressure. My A1C, so you can see on the left are my results. But more importantly, I think the triglycerides is the one that I want to point out. As you can see with my triglyceride risk on my scan on the right, it's about a 52.5. So that 52.5 kind of puts me in the orange, which is a little bit of elevated risk. So it's close to the triglycerides because that shows that I'm actually I'm borderline on the triglycerides. All of my other vitals are okay. And unlike Al, I don't have a 50 beats per minute, but probably with this webinar, my heart is beating a little faster than normal. So as you can see, we get pretty close, and we are able to, more importantly, get that employee to really take the next step. Because once you see you're in that yellow, you're in that orange or that red, you know you're at risk. And that's where the next step happens. As you scroll down on your results, you'll see an option to email the results. You can just click email result and it'll be sent to you and it'll actually explain it. So that's really what employees see with their results. And the first reaction is usually, okay, this seems important, but what do I actually do with this? And that's exactly why the clinical layer matters. So we don't just do the scan, we provide the clinical care for longitudinal care because insight without interpretation doesn't actually change behavior. This is where the care guide and clinical support come in. Our clinicians who are doctors, nurses, dietitians help translate this into something actionable. What actually matters versus what is noise is what we deliver. What should they act on now versus monitor over time is what they'll get out of the sessions. And what's the right next step, whether that's lifestyle change, labs, or follow-up care. And just to be clear, this isn't just for high-risk individuals. This is for your broader employee population, people who are working, busy, trying to stay healthy, but don't always know what to do with this type of information. Now, we obviously provide that clinical support at Hibiscus, but we also recognize that many of you already have thoughtful clinical partners in place, and we're designed to work with that. We can share the underlying face scan data with your existing partners as you consent, whether that's a health plan, a care management vendor, or another solution, and they can own the results review and ongoing coaching. So this isn't about replacing anything you have. It's about making sure more of your covered lives actually get to the point where that clinical support can be used. At the end of the day, this turns a quick screening moment into something that actually leads to action. And what you're looking at here is one of the most important parts of the experience. Instead of a one-time snapshot, employees have access to our engaging mobile app that allows them to see data trends over time. So they can see, am I improving? Am I stable? Is something moving in the wrong direction? This is what drives behavior change because now it's not abstract, it's visible. And from an employer perspective, this is what helps sustain engagement across your covered lives. It's not just a one time screening event, it becomes something employees come back to. For employers, this becomes a high engaging entry point into your health strategy. Pilots are live in a few weeks. The question isn't whether this fits, the question is how quickly you want to see this across your covered lives. And if it's one thing that you take away from all of this, is just know that this is 10 times cheaper than your typical biometric screening and it provides you with about 6 to 8 times more engagement of people doing their screening using our process. And we
And if I might
Mhm.
add to that, one of the things that used to really drive me up a wall about wellness is you need huge incentives or huge penalties to get people to do this. No, you don't.